Hello, everyone. Thanks very much for joining World Child Cancer session on empowering young lives. On this session, we will be focusing on exploring global impacts, benefits, and insights that a fantastic health tech app has offered us, the beneficiaries in our program countries and also across international scale within certain hospitals globally. An app called Xploro, an innovative app providing essential healthcare information on childhood cancer. We just start this session with a brief introduction about who we are, what we do, who we have on this panel as our key speakers, and proceed further. So my name is Ghazaleh. I'm a program advisor for World Child Cancer. And World Child Cancer is an international charity with a key mission on addressing healthcare disparities within 13 countries across Asia, Africa, and Central America. We focus on health disparities within childhood cancer. And while we have been active in this sector since 2007, our relationship with key partners have grown throughout the service and international collaborations that we have been delivering across the world. One of these key collaborations have been with a company called Xploro. As mentioned earlier, Xploro is a health application which was co-founded by Raban and has been in use since 2020. It provides essential information in relation to childhood cancer procedures, prepares the children for the upcoming treatments that they may need to face, but not also children, their families, guardians and caretakers as well. And obviously, the less the anxiety of children is in relation to treatments and the better their understanding and preparation for healthcare experiences are, the more active they are in their health journey and the more engaged and the greater engagement obviously provides healthcare providers with a more efficient and less invasive care at a lower cost. So on this panel, we have Tom, who is the co-founder and CEO of Xploro. His connection to the initiation of this app comes from his personal experience. His daughter when his daughter recovered from cancer treatment, basically John realized that lack of sufficient information that was available to his daughter in relation to treatments, people and places during her treatment journey, it obviously increased her anxiety and affected her long-term engagement with health service providers. The app created is an award-winning app and has been used in hospitals in the UK, US, and Europe. And through the partnership we have with Xploro, we have also had this amazing experience of using this app for our beneficiaries, children in low and middle income countries. We have Professor Lucy Bray, who is the Child Health Literacy Professor in the Faculty of Health, Social Care and Medicine at Edge Hill University in the UK. Lucy's research interest primarily focuses on education, information needs, and preparation of children, young people, and their parents for procedures and interventions. And last but not least, Lucy has worked within acute children's nursing for over 25 years, specializing in children's procedures and surgeries in the UK. Her work experience primarily explores how children and young people can be involved in creating meaningful health information and how the information then impacts on healthcare experiences. Next, we have our two fantastic play therapists, Augusta, who works as child life specialist / play therapist in Vulture Cancer at Kolybu Teaching Hospital in Ghana. Her background is in psychology, and she was inspired to pursue a career in child life after she worked in a mental health capacity that also provided services for children in the hospital by creating an environment where they could interact with each other and go through the treatment through play therapy techniques and social well-being mediums. We have Ida, our other play therapist, child life specialist, who is working in child cancer at Queen Elizabeth Central Hospital in Malawi. Ida has got work experience of around 7 years in psychosocial support, and her background is in social sciences. She's been with World Child Cancer since 2021. Both Ida and Augusta have key experiences in using Xploro application in the field. So the way this session is organized is we have the founder of Xploro to walk you through his journey and making everyone familiar with the app. We have an expert from research side, Lucy, to provide insights on the impact of using such apps in relation to making children active in their health journey from research side. And then we have key experts to walk everyone through the implementation of the app in practice. There will be Q&A sessions. Everyone is highly encouraged to type their questions in the chat section of the session, please. Yes, so that's a brief introduction. Next, I will be handing over the platform to each of the key speakers here. We start with Dom to walk us through Xploro app. A further explanation in terms of how World Child Cancer and Xploro got connected. Just a brief note to add that we were introduced in 2021 via one of our NHS contacts to Dom's initiatives on having created Xploro app. This offered us a unique opportunity because having been active partners in relation to addressing childhood cancer challenges in low and middle income countries, it provided us with a unique platform to engage children as active partners in making their own health journey more tailor-made to themselves through information, through empowerment, giving them the agency. A very major development in relation to how we have been implementing projects in low and middle income countries. And last but not least, to mention that once we established connection to DOM, we were offered a cost-free license for this application, which has been massive saving, obviously, for us. And to that, we are obviously very grateful to that end. Yes, we have been using this application across our country programs. We started with Ghana in October 2021. And then after a pilot Xploro project in Ghana, we started using it in Malawi in December 2022, since December 2022. And then in year 23, we started using it in Cameroon. And right now we are using it in Indonesia and Nepal as the latest additions. I'm sure Ida and Augusto will provide further insight in relation to user experience. So at this point, please allow me to hand over the platform to John Rabin, CEO and co-founder of Xploro. Thank you very much.
Thanks so much for the intro there, Ghazali. Hi everyone. I'm just going to walk you through 4 or 5 slides, and then I'm going to stop sharing my slide screen and share the Xploro screen so I can give you a demo of Xploro. So, the Xploro story really started with this young woman. She's my daughter, Izzy. And this photo was taken at the top of the Empire State Building back in 2014, when Izzy was 16 years old. Out of shot are my wife and my then 14-year-old son and myself taking the photo. And we were there courtesy of the charity Wish Upon a Star, who granted Izzy's wish of a family road trip from Orlando down in Florida up the eastern seaboard to New York. And it was a very emotional moment as the 4 of us stood there, gazing out at that amazing view and deep in our own thoughts, reflecting on the events of the past 3 years and thinking about what the future might hold. So flashback to November 29th, 2011. And on that day, Izzy, at the age of 13 years old, received the tragic news that she'd been diagnosed with Ewing sarcoma, a rare bone cancer. Thankfully, Izzy's now 13 years cancer-free, and in fact, she's just returned from a year of solo backpacking through Southeast Asia, so she's doing great. But when she was going through treatment, there was a stark lack of age-appropriate information about the treatment she'd have, the people she'd meet, and the environment she'd be treated in. And whenever there was any information about any of these things, it was directed at my wife and I rather than at Izzy, who at 13 years old was perfectly capable of understanding and processing information about her cancer. And the net effect of that lack of information was that she felt scared, anxious, and alone. But that experience isn't unique to Izzy. Across the board, provision of information preparing patients for treatments is poor. And we know that patients who are poorly informed experience high levels of anxiety, which can be long-lived and lead to poor engagement with health services and poorer health outcomes. And this lack of information can also create behavioural or psychological problems, which in turn can negatively impact both home and school life. But lack of information doesn't just impact the child's mental health. When patients aren't emotionally prepared, this can result in procedures having to be repeated, longer appointment times, greater need for pre-procedural sedation, reduced adherence to medicine regimes, and an increase in missed appointments, all of which considerably increase the cost burden on health services. So that's why we created Xploro. It's a patient education platform that uses 3D augmented reality models, an avatar conversational agent, interactive storybooks, and a series of games to help young patients feel engaged, empowered, and informed whilst having fun at the same time. So rather than feeling like conventional hospital educational material, I often describe Xploro as sitting somewhere between Pokemon Go and The Sims. So by engaging both patients and their families in their healthcare journey, what we're trying to do is reduce anxiety and improve outcomes whilst reducing costs for healthcare organisations. We're commercially available around the world. And our customers include world-renowned pediatric cancer centers like Boston and Cincinnati children's hospitals over in the United States, and the amazing Princess Maxima Centrum in the Netherlands. But unfortunately, a platform like Xploro is low on the list of priorities in low and middle income countries where resources for even basic healthcare needs can be hard to come by. So, as Ghazale said, about 3 years ago, we teamed up with World Child Cancer to make Xploro freely available to children in hospitals, supported by the charity. And it gives me real pride to say that we're now live in 3 hospitals in Ghana, 2 in Cameroon, 1 in Malawi, 2 in Indonesia, and 4 in Nepal. So that's the end of my slides. I'm going to swap screens now and swap over to the app to take you on a quick tour. So just bear with me 1 second. Okay, so now hopefully you can see my iPad screen. Normally, Xploro is primarily designed to sit on the patient's own device, either a tablet or a mobile phone. And that's because there's very good evidence to suggest that the best time to provide pre-procedural information is at least 5 to 7 days prior to the procedure. We're available in a number of languages. This is a demo version of Xploro, so debug is not a language. It's for our developers to use. But we're available in UK and US English, Castilian and Latin American Spanish, Chichewa, Nepali, and Bahasa Indonesian. I'm going to show you it in UK English and tap continue.
Xploro app link code.
As you can hear,
Get started by entering your app link code.
all of the written content is also spoken. I'm just going to turn off the voiceover now because it interrupts my presentation. So I'll just turn that down and put in a code. So just bear with me 1 second. So the code is FZSN2C. So I'm into Xploro, and if I tap Get Started, the first thing we see is a present bouncing around. And if I tap the present, out pops an avatar. And the whole premise of Xploro is that the child creates and customizes an avatar, which then becomes their guide through their healthcare journey. Now, at this stage, the avatar is bright yellow and in underwear. That's because the avatar at this point carries no gender or racial alignment. It's up to the child to add those characteristics. So if I tap the forward arrow, it says I'm here to show you around Xploro. And the first thing we're going to do is customize the look. So I'll just change some of the parameters. We'll start with skin color. I'm going to put some hair on. I like a good pair of glasses, so I'm going to put some glasses on as well. Let's make them red. I'm going to change my mouth shape, and I'm going to put some clothes on. Very important. So there's my avatar. A couple of other things I can do in our avatar customizer. So we can have the avatar in a wheelchair if we want, or wearing a face mask, or maybe just wearing a smartwatch. And I'll tap done. Excuse me. Now, next, we're going to give our avatar a name. Now, there's no opportunity for free text entry here because we use the avatar in multiplayer gaming. So what we do is allow the child to choose from a list of first names. I'll go with Big Al, and I'll choose a second name. Let's go with Big Al Chewy Buns and tap done. So there's my avatar, Big Al Chewy Buns, a bit of a mouthful. It now says it's time for me to enter your world. So what I'm going to do is just tap that forward arrow, and I'm just going to move my iPad stand, and you'll see that my camera's been activated, and you can now see my desk. So a balloon is going to appear any second now. And when that balloon turns green, if I tap it, there is Big Al stood on my desk, and I'm going to move him around. I'll move him over here to my keyboard, and I can make him smaller and bigger. And this is just about making the avatar feel real to the child. So we've gone through onboarding now. What I'm going to do is walk you through some of the main features of Xploro. Here on the home screen, there's a few things to point out before we go any further. So top right in the settings menu, I can turn that read aloud feature on or off. So I'm going to turn it off now. so that I can turn the volume up for other parts of the app. So that basically means you won't hear the child reading out all of the written content. In the red balloon up here, also top right, means that anything you're viewing can be seen in augmented reality. You just saw my avatar in augmented reality, but you can see things like equipment and environments in augmented reality. A notification has just come up telling me that Dr. Test has some questions. That's our questionnaires feature. I'm not going to show you that today, so I'm just going to tap maybe later. And then that bottom left, my avatar is always present in a speech bubble, and that's because at any point I can ask my avatar a question. So if I was to say, for example, will my operation hurt? It will give me a response. So I'm going to close that, and I'm going to go up to the menu. And I'm just going to talk you through some of the main menu items, starting with the picture of a clinician at the top of the dial. So really confusing when you come into any hospital environment, understanding who everyone is and what they do. So here we have a list of avatars representing all of the people you might meet when you come into a hospital. I'm just going to choose one. So let me find, I'm going to choose a nurse. And if I tap the pencil top left, I can put my nurse's name in. Let's say she's called Susie. And then if I tap the other pencil, I can make the avatar of Susie look like my nurse. So I'm just going to change some of the parameters again. We'll change skin color. I'm going to change hairstyle. And tap done. And if I go back to the list, you'll see that the nurse I've just created is now sat in the list. This is a really important feature because it helps children remember who the healthcare professionals looking after them are and also what their names are. Sometimes they build bonds co-creating these avatars with their healthcare professionals. And you can go on and do that and customize the whole list. Okay, I'm going to go up to the menu now. I'm going to go anti-clockwise into the next section, which is our storybooks section. In our storybooks, we explain complex treatments and procedures. And in each of these storybooks, we try and answer 3 questions for the child. So the first question is, what's going to happen and what's my role in that process going to be? The second question is, what's it going to feel like? And the third question is, what coping strategies can I use to help me get through that procedure? Okay, so as you can see, we've got a whole lot of storybooks here. I'm obviously not going to show you all of them today. I'm just going to pick the one on cannulation. So you can see there's my avatar, and my avatar is going to explain all about cannulas. There's a couple of things glowing orange in the scene. That means I can just tap them to find out what they are. So we've got a drip stand. We've also got a radio. If I tap the radio, I can choose some music to play along with the experience. I don't know if you can hear that music coming through, but I'll turn the music off, I think, for this demo. So we'll go with no music. And then if I tap the forward arrow, it's telling me what a cannula is. There's a cannula in my avatar's hand. If I tap it, I can see a close-up, and I can see that it's a bendy straw. I tap forwards. It's telling me where it goes. Now, a nurse is coming into the room, and for the eagle-eyed among you, you'll realize it's Nurse Susie that I just customized. And that's because once you've customized an avatar, they populate all the sections of the app. So it's a very personalized experience. Now it's giving me a coping strategy. It's telling me I can ask as many questions as I want. I can have someone with me. I can take something to distract me. I'm in charge, basically. I'm not going to go on with this experience, but it then goes on and it takes me through everything that's going to happen. I'm going to come out of there and I'm going to go into the next section. Well, I'm going to skip the videos section. That basically the video section just enables you to watch videos from any source. I'm going to go round to our games section, and this is arguably one of the most popular sections of Xploro. Each of our games has a different learning outcome. I'm maybe going to show you 2 of these games. I'm going to start with a game that we've just very recently developed called Recovery Rush. This is all about what happens in the recovery room after surgery. I'll skip the tutorial because I know how to play it. And I'm going to just skip this intro video and go straight to the game. So I'm going to play level 1. This is basically a management game where you're in charge of managing, attending to the patients in the recovery room. So today I've got 4 patients to look after. I'll just look after one of them for the time being. So that's telling me that the patient needs their cannula removing. So I'm just going to pick up a dressing and then I'm going to go over to the bedside and remove the cannula. Oh, and another patient wants the same thing, so I'm going to attend to them now. Meanwhile, my first patient wants discharging, but I haven't got time to do that yet. So I'll just go over and tend to this cannula. And now I'm going to discharge this patient. And you can see, I'm not going to carry on playing this game, but you can see that as more and more patients come into the room, it becomes more and more stressful as I've got more and more patients to look after. So I'm going to exit that game. The other game I want to show you is one of the first games we developed way back when we first started out. It's called Plasma Patrol. And this game is all about blood cancers. And if I tap next, the object of the game is to collect platelets, lymphocytes, vitamins, chemotherapy, and iron, to destroy cancer cells and to avoid white blood cells, fat cells, pathogens, and dead cells. Okay, so I'll tap play solo. Here's my avatar running down the hospital corridor. In a second, you'll see them jump in a spaceship. A spaceship's going to take off and land in the bloodstream, and that's when the game begins. So I'm going to attempt to play this game. So I'm controlling the rocket that you see with my finger bottom right. There's a bag of chemotherapy over there. Let me try and get that. No, I just missed it. If I'd caught it, I would have got 300 bonus points. Instead, I'm getting a lot of white blood cells, which is not very good. As you can see, I'm not the ideal person to demo this game. I've seen Lucy's son play it, and he's really, really good, but me, not so much. Anyway, I'm getting some cancer cells now and scoring some more points. But I'm going to pause that. The reason I wanted to show you that game is because about a year ago, we got a really amazing email from the mum of a 12-year-old boy who was being treated for osteosarcoma. And she sent us an email that said that the night before his 4th round of chemo, he played that game. And then the next day, when he went in for chemo, he said to his nurse that he finally understood why he was having chemotherapy, all because he got 300 bonus points for capturing a bag of chemotherapy in that game. And she said there was a lightness about him that she hadn't seen before. So I think that just really speaks to the power of games and gamification to help to change attitudes and behaviors. I'm going to show you one more thing, I think, before I hand over to Lucy. So the next section is our environment section. And here we have a series of environments. These help children familiarize themselves with the hospital environment before they come in. The one I'm going to show you here is the pre-op environment, which is center screen. And what I'm going to do is I'm going to show you this in augmented reality. So I'm going to tap the red balloon. And I'm going to just pick up my iPad and wait for the balloon to appear and turn green and tap it. So what you're seeing there is the pre-op environment on my desk. This is modeled on a pre-op environment at a hospital called OHSU Dornbecker in Portland in Oregon. And it's an accurate model of the environment. I'm going to navigate around it, not by pinching or zooming on the screen. I'm going to physically move the iPad towards or away from the model. So right now I'm zooming in by just moving the iPad closer to the model. I can navigate around and see patients in bays. I can pull back. I'm going to come over here to the waiting room. I'm going to tap some things in the waiting room. Just tap some chairs there. Oh, there's my avatar in the bottom corner there. You can see I can go in real detail. I can almost read what those books are on the bookshelf. And then if I come up, I'm going to just tap these curtains. It's very much about kind of tapping things to see what they do and exploring the environment in that way. There was an IV pump there that I just tapped. Maybe if I tap this wheelchair here, it will do something. Yeah. Oh, and there's Nurse Susie, you can see, has just come into the scene over there. So I'm going to pull back now. And you can imagine that for a child, being able to interact with the hospital environment in this way before coming into hospital is a really good way of reducing that anxiety about what can be a very scary and unfamiliar experience. Okay, so what I'm going to do is I'm going to come back to Xploro a little later on and show you how we've localized Xploro for use in both Ghana and Malawi, and I'll take you through some of those localizations. But for now, I'm going to stop sharing my screen and hand over to Lucy.
Thank you, Dom. I'll share my slides now. Always so amazed by how incredible Xploro is when you watch the tour through it all. It's just so engaging. Really great to see it. Okay. I think that's gone to full screen now. So as introduced at the beginning, I'm a children's nurse by background, worked for many years within Children's Hospital, dealing with and caring for exactly the children that Dom's just been describing here, have children coming in for a variety of procedures and interventions and tests and treatments, and moved into research and have tried to bring those kind of child-centered principles into all the research we do. It's been a massive privilege to be involved with to partner with research with Xploro. So I'm going to talk you through a couple of the projects that we have been involved with. Dom's alluded to some of this, but from a research evidence point of view.
Hello. What language do you
sorry.
Your avatar's giggling in there on my presentation. How rude.
Sorry, Lucy.
Tell it to behave. So from a research evidence point of view, we know that when children are not prepared and they're not informed, and they don't know what's going to happen, they are more likely to be anxious. They're more likely to have poor experiences of procedures. They're more likely to be distressed, and they're more likely to be held or restrained for procedures. So we know this, and we've known this for many years. We know that children continue to not get the information that they need to help them prepare and cope during a procedure. Still, quite often, adults believe that it's in a child's best interest for them not to know, that it will cause them to worry and become anxious. So still we hear where children are excluded from being able to access accessible, meaningful information that's targeted for them. Ooh. And I think there's a real need to develop but evaluate these resources that we're making. So within health services, often we're very good at developing materials. So we go through a cycle of listening to children and developing materials, but we don't always robustly evaluate them, learn from those evaluations, and see how the resources and the interventions can be adapted based on that evidence. And so that's exactly what Xploro, right from the beginning, I guess, was kind of leading the way in knowing that that evidence was really, really important when it came to putting that interventions in place. All of our study designs and data collection methods have been informed by consultation with young people. So we did lots and lots of consultation right at the beginning with some amazing young people in some local schools. And then obviously Xploro has its amazing advisory board, which is full of very expert young people who've made sure that all of the research that we've done has been based on what works for young people and families. Often at times that they're having quite stressful procedures, it's really, really important that our research is designed to be child-centred and not add burden or anxiety to these children's hospital experiences. So the first study that we did, and I was looking back at the timeline, was back in 2018. This was a two-part study. The first part of the study looked at what questions do children have about procedures. So where Dom was showing in his presentation the chatbot where children can ask questions when they're coming to hospital, we did lots of extensive work with children to hear from them what questions do they have about the procedures that they're about to have, what information is important for children to know about procedures, and how should that information be delivered. So all too often, we're designing children's information based on what we as adults think that children should want to know or what children should be told. And quite often the questions that children have are different. And so we felt that this was a really important phase to make sure that that chatbot and the content of Xploro is based on what children actually want to know. And so we collected thousands of questions that children had and thought that it was important for children to know about procedures. We used activity sheets with over 100 children aged 8 to 12, with a range of coming in for a range of different hospital procedures such as ultrasound scans, x-rays, blood tests, having plaster casts for broken bones, MRI scans, and a range of treatments, with children who also had a range of experiences. So children who it was their first time that they had a procedure, but also children who may have had multiple procedures. So we use these activity sheets while they were waiting in the waiting room. Often the children engaged with these really, really well. And then we interviewed a small group of those children, parents and health professionals, to really explore their perspectives on how we're providing preparatory information to children. What should that look like? How best could it be used? And then the second part of the study, after that, Dom then and his team went and created Xploro, was we conducted a before and after study. And by that we mean that we collected some data from children and young people who didn't have access to Xploro, who were accessing usual care, so the normal information that children would get in their normal kind of day-to-day interactions with healthcare services. And then we had a group of children who accessed Xploro. So we had 40 in each of those groups. So 40 children, collected information from them first as a group, as a cohort, and then we collected information from 40 children who had Xploro. And those children, as Dom said in his presentation, accessed Xploro up to a week before their procedure, because these were slightly older children. And we know for the majority of this age of children that having information about 7 days beforehand enables them to have the information, process the information, and think about how that information applies to them. And we measured child and parent procedural anxiety, knowledge, their perceptions about how involved they were in their procedure, and their satisfaction about their procedure. And we measured that at baseline, before they'd accessed any information, before their procedure, and then again after their procedure. So from the development work, from the first phase, we found that children asked lots and lots of different questions, and they asked questions often in a sequence to build up and develop their understanding and knowledge. So often they would ask questions first about what was going to happen. And then when they knew what was going to happen, they would have time to process that and think about, okay, so what would that feel like for me? And then often those older children would then layer on top of that to think, okay, so that's going to happen. This is how I will feel. What can help me cope with that? What can help me stay calm? What can help me get through this? All of the children that we spoke to wanted information. They wanted information about the health hospital procedures, and they wanted it in an honest way. They wanted it in an accessible way, but they also wanted it to be engaging and understanding. But we also found out that the parents had quite a key role acting as gatekeepers. So it was really important, and I think, I don't know if Dom will pick it up later, but we know from the work that we did that whilst the children were learning about procedures and they were looking at Xploro, the parents were also learning as a byproduct of that. So the parents were there while their children sometimes were looking at some of the information. And I think sometimes that we assume that parents can access the information that we give to parents or will know things. And I think sometimes we don't always equip parents with the knowledge that they should have. So Xploro as a byproduct worked really, really well for parents to feel safe and that they have such a key role in facilitating their child to access information. If the parents are happy with the information that's being provided to their child, then they're more likely to prompt and work through that with their children. The image at the bottom right hand of the screen is just talking to these different kinds of information that children identified was important for them before they came to hospital. So the actual facts of what's going to happen, who will be there, what will the room look like, the sensory information, will it hurt, what will I feel scared? And then only when those kind of building blocks of information are in place, then can children start to think about, okay, so what can help me be calm? Who will be there to help? What did we find out from the second stage, from the before and after study? Well, the children who were given access to Xploro, they supported significantly lower levels of procedural anxiety before the procedure. They reported they felt more involved in their procedure. They reported that they had higher levels of satisfaction with their procedural experience. And there was a significant difference in their perceived procedural knowledge before the procedure. So we asked them how much they felt that they knew, and there was a significant difference between the group that had had access to Xploro and those that had not. When we talked to the children, they reported that they enjoyed using Xploro. It was fun, it was easy to use, and they felt that it had a real positive impact on their procedure. The parents whose child used Xploro themselves, as I say, it not only informed children, but it also informed the parents that were with them. They themselves demonstrated significantly lower levels of pre-procedural anxiety. They were more satisfied with their child's procedural experience. They also had higher perceived reported procedural knowledge. Let me move this over the top of the slides. And they also told us very clearly that it really helps them sometimes open up conversations with their child. So when we talked with the parents, they sometimes don't always have the words to be able to discuss what an MRI scan is, what a blood test is going to be like. And so being able to play the games with their child, look at some of the content with their child, it really helped them know how to approach those conversations. Got a quote here, just one quote from the child where they felt that it taught them lots and lots and it made them feel less worried. So it showed quite clearly that Xploro was working really well as an intervention to help children having a range of procedures. Just to show the papers reported linked to that study that we completed, just for reference, if anyone wants to go and have a look at those. And then we've had the pleasure to be involved in a more recent study, which was linked to children having needle procedures, so children having blood tests and cannulations. So we know needle procedures particularly are one of the most feared experiences that children face. It's often the one that is really difficult to prepare a child for. And so this had real potential to reduce children's anxiety. We know that if children have poor experiences of blood tests and needle procedures, then these can be lifelong bad experiences that can lead children then to avoid vaccinations, can lead children to avoid future healthcare experiences. So it's really important to get these experiences right. And so we were really fortunate to conduct a small study. The bottom right, I don't know if you're going to show later, Don, but this is a bespoke environment for the District General Hospital that we were working in. This was really powerful for children and young people because the chairs are where the chairs are. So when they come through the door, it looks exactly as it does when they go into the departments. They knew where the doors were going to be. They knew where the doctor would be sitting. And so we conducted a small acceptability and feasibility study looking at what our families' experiences of using the Xploro blood test module before they came in for a planned blood test. So again, we used activity sheets because these work really well while people are sitting around in waiting rooms. And we designed these with children and young people. And they were asking children, their parents, and the health professionals working within this department to tell us about how has that Xploro blood test module worked? What was your perceived impact of using it? What was good? What maybe wasn't so good? An interesting finding, which was kind of a byproduct of the research, was that as we were contacting families to talk about the research study, of the 47 families that we contacted to possibly take part, 6 of those families didn't want to take part in the research study because they did not want to tell their child they were due to have a blood test. So these were children that would have been told on the morning of their blood test that they were coming to hospital, and often the first time the child would know about the fact they were going to have a blood test would be the morning of or when they arrived in the department. And when we think back to the research evidence that shows how the best way is to prepare children, this kind of means that these children have not got a chance to develop those building blocks of preparation and coping skills. So we felt that this was really an important finding, and it shows that as a health service, we have much more to do to maybe coach and equip parents with the knowledge to know that if children are prepared in a meaningful way, they are likely to have better procedural experiences. So I'll just briefly talk through this. The children that were involved in this study, a huge majority reported that they enjoyed using Xploro. They found it good, fun, and it helped them understand what was going to happen. Again, the majority showed them that the app helped them a lot, otherwise they didn't know what was going to happen. So this had a really positive reported effect on these children and young people. The parents also stated that the app had really helped their child to have a blood test completed successfully, in the fact they knew what to expect and they knew who they would be seeing. We had a couple of parents and children talk about how seeing the app and seeing the content would make their child worry a little bit more sometimes before a procedure. But we do have evidence that shows that whilst it might make them worry a little bit more before, in the long run, it usually is a real benefit, children knowing actually what's going to happen. All of the professionals felt that the app worked really well in their department. It helped prepare children, helped them know what to expect. And I really like this quote from the healthcare professional where they felt that as they had been getting on, doing their kind of clinical care, they were aware that the app was being talked about in the clinic room while families were waiting. They could hear parents talking about it, and it helped, as it did in the first study, open up a dialogue about what might happen. So we know parents can struggle sometimes to have the words to say to their child, we're going to go and have a blood test, because they don't really know how to answer those questions when the child says, will it hurt? When the child says, what will happen? When the child says, blah, blah, blah. Whereas the app and Xploro actually help them have those conversations. And there's a paper available that describes that second study in more detail. Well, thank you. That was a brief overview of many years' work. Thank you. I'll stop sharing my slides.
Thank you very much, Dom. Thank you, Lucy, for the fantastic presentations. Next, we will be moving to walk everyone through how the application actually has been benefiting children in two hospitals, one in Ghana and one in Malawi. The presentations will be given by our play therapists. Augusta and Ida, I'm ready to share the slides. Handing over to you, Augusta.
Thank you. Hello, everyone. So my name is Augusta Isidilate, and I am a child life specialist at Kolimi Teaching Hospital, working with raw child cancer. Today, I want to talk about using Xploro in a pediatric oncology unit in Ghana. So Xploro has its presence in Africa, and it's in Ghana. You can see the red, yellow, green with the black star in the middle. So Ghana is a West African country. It's bordered by Togo from the east, Ivory Coast from the west, Burkina Faso from the north, and the Gulf of Guinea from the south. Yes. So Xploro is present in 3 major hospitals and some of our shared care centers. So let's go to the next slide. So some of the hospitals that Xploro is present in include Kolimi Teaching Hospital, Komfo-Anokye Teaching Hospital, Greater Accra Regional Hospital, which are all in the southern part of Ghana. We have Tamale Teaching Hospital, which is in the north, located in the northern part of Ghana. Whole Teaching Hospital is at the extreme east of Ghana, and then Holy Family Hospital is found in the Bono East region of Ghana. So what are some of the things that we do as Child Life on a daily basis? Child Life is to help children cope in the hospital. And so we arrange children about the things that will be done in the hospital, and Xploro has been very helpful. We prepare children for their procedures, and then we offer diversional therapy. And then we also engage them in activities that will help them feel comfortable in the hospital. We engage them in activities that they normally would do in the house or in the school with their friends and their peers. Next slide. Okay, so with using Xploro, I would like to talk about a boy I engaged with. He was 8 years and he had acute lymphoblastic leukemia. So we looked at the app. I gave him the app, and then I introduced him to the avatar, and then he customized it. He looked at all the roles that the healthcare professionals play, and then he looked at some of the icons. In fact, we looked at the storybooks, and that included the patient monitor, the scans he had to do. Sometimes before children will come, they have already done some of the scans in some other facilities, but they don't understand why they had to do the scans. So this becomes an opportunity to explain to them why they had to do the scans. So I got the opportunity to tell him why he had to be doing some of the scans that he will be doing, because they were they had been asked to do some of these scans. Okay, so Xploro helped with explaining some of these procedures, as I said, and children have to go through procedures like cannula placements, and sometimes it's uncomfortable, but it's crucial. So helping them understand why they have to do them helps them to feel relaxed, and it helps them to cope better, because they get to learn some of the things that they can do, some of the coping mechanisms that can help them be able to go through the procedure successfully. So it really helped to explain procedures like the cannula placements, which most children in the oncology units would have to do because of their medications. Okay, so why is Xploro so important? Xploro is very important. It has a lot of impact in the care of children because it makes it easier for the medical team to carry out their procedures. So I can recall one time when I had to be in the treatment room. I missed a child crying and screaming, and it was very difficult for the medical team to calm her down because she was scared of the procedure. So at that time, I didn't know what to do, but then Xploro came in handy. So I took it out, and then we went straight to the cannula placement story. And then I told her about a child who was just like her going to do a procedure with a cannula placement. And then that was how she got to give me her attention. And a procedure that would have taken a long time was cut short. And the doctor was so happy that I came in to intervene. It was very helpful. So it reduces the stress that children have to experience when they are going through these procedures. And then it reduces the anxiety they have to go through before they undergo a procedure. So this was a recent child that I engaged, and he had to undergo a surgery. He is 15 years and he was new to the hospital. So I took him to Xploro. I showed him some of the things that the staff do, the roles that they play, and the scans that he had done already, and the things that he would need to do, some of the scans that he needed to do. And then he told me of his fear about the surgery. So I took him through the surgical rooms, the anesthetic room, and then I showed him some of the equipment and what they would be used for. It comes in very helpful because ideally you're supposed to take the children to the hospital, the theater, and then show them some of the things, but Xploro gives them a picture, a visual representation of everything that they are going to experience. And he said that after using the Xploro app, I was less scared about the surgery, and I was so happy that it was helpful to him. So yes, thank you.
Thank you so much. My name is Aida Nkoma. I'm also a child life specialist working with all child cancer. Just to continue the conversation that my colleagues have started. So, like I said, I'm in Malawi. Malawi is in the southern part of Africa, and it is bordered by Tanzania, Mozambique, and Zambia. Yes, so I work at Queen Elizabeth Central Hospital, and it's one of the largest hospital in Malawi. And every year it registers about 200 new cases of childhood cancer. So as a child life specialist, normally what I do when I come to work is I assess the children on a daily basis, how they are doing mentally. And also finding out the children who are to undergo for a procedure, and also prepare them for that procedure. And also even provide distraction during their procedures. As you can see, a child having a cannula and I'm there distracting the child. And also engage the children in play. Since they're at the hospital, they need to continue playing for their development, and also for normalization since they're away from home. So Xploro has been a very important tool in my work as I work with the children. So through Xploro, children engage in games. That means they have fun time, they play. So they either play the games on their own or with their friends, competing who is getting to the next level quickly and the like. And also through the avatar customization, the children have fun with that. And I also use Xploro in preparing children for their procedures. So helping the children understand the procedures that they are to undergo. So whether it's a CT scan, I prepare them using the Xploro app, whether it's X-ray or ultrasound. So Xploro is comes very handy with that. And Xploro is very important because with the pictures that the children see, the children are able to visualize the real medical equipment that are going to be used on them. And that reduces the levels of anxiety and fears. And like in my context in Malawi, when children are undergoing for their examination or medical examination, so be it a scan or X-ray, is called ujambulisa, which can be literally translated to photo shoot. So a child will be told you're going for a photo shoot. But going there, he or she sees a different environment, and that can be frightening. But with Xploro, it helps the children to understand the real equipment, the medical equipment that are going to be used on them. So this is a case study of a child, a 13-year-old girl who was diagnosed with Worm's tumor that was affecting her left kidney, and how Xploro helped her or supported her, how she was supported with Xploro during her procedures and during her cancer journey. So with her diagnosis, she's supposed to go for various scans, be it X-ray, CT scan, ultrasound, and also having intravenous therapy. And after the end of the chemotherapy, at some point, she'll need to undergo for surgery. Next, please. Yes, so with Xploro, when she came in, she appreciated or she learned, she now understood the various stuff that are found in the oncology ward. So the nurses, the matron, the doctors, the clinicians, and other staff that come in the ward, for her to be informed, and also know to be for her to know who comes on the bed and the exact support that medical staff provides to her. I mean, yeah. So with the other procedures that she had, X-ray, CT, X-ray, CT scan, I also had to prepare her for those procedures using Xploro. Next, please. Yes, so after the end of chemo at some point after the chemotherapy, she was supposed to go for her surgery. So through Xploro, I, I was able to prepare her for the upcoming surgery, showing her the room, how the room will look like, and when she's walking into the surgical room, the pathways until she reaches the surgical room, and yeah, everything that she'll see in the surgical room. Yeah, she had some questions based on what she was seeing, because now she started understanding what was going to happen. So using Xploro, where I was able to answer some of the questions that she had. And it's funny, after the surgery now, I went to her just checking on her, how she was feeling, and how the surgery went on. So she was very excited that she had her surgery done. And she was, yeah, ready now to engage in other fun games that she missed. And she told me that during her surgery, she was very calm, because what she had seen on the app is exactly what she saw in the procedure room. So it gave her like confidence for her to become, because she knew that nothing else is going to happen that is going to be strange on her. Yeah, next please. Yes, so that's one of the stories, some of the stories on how Xploro is helping children as they are receiving their treatment. So be it other procedures, whether it's cannulas or CT scans, X-ray, children are being supported using the app, the Xploro app, and it's being very helpful as the children receive their treatment. Thank you so much.
Thank you very much, Ida and Augusta. It's great to see how this whole technology and research behind it is being implemented in the field, practically, basically. I'd like to open for questions. And
were we not going to go
yes,
back to?
no, sorry, before going back to questions, yes, John, handing over to you for the next part, please. Thank you.
Great, thank you. Just bear with me 1 second whilst I share my screen. And I have to say, it was really fantastic to hear Ida and Augusta talk about how Xploro is being used. Makes it all worthwhile. So great to see those examples. So what I wanted to do just in the next few minutes before we get into questions is just show you how Xploro is localized for different countries. So first of all, you saw in the earlier demo how I would name the avatar from a list of first names and second names. So if I tap the pencil here, now we have different name sets for each different territory that we work in, and loaded here is the Ghanaian name set. And Augusta, I'm not going to attempt to either pronounce or say what any of these names mean, but I know you involved a group of children in Ghana in coming up with funny name combinations. So we've got first names and second names. The language selection here, this is a bit of a mix between Ghana and Malawi. So we've got Ghanaian names, but I've loaded Chichewa as the language. So the whole interface of the app now is in Chichewa. If I go up to the people section, which I showed you before, whenever we localize for any of the countries, we work with the healthcare professionals in those countries to understand what the various staff roles are that children will encounter in that hospital. So again, we have a bit of a mix here because we have the Ghanaian healthcare professionals, but with Chichewa titles. So you can see over on the far left there is a chaplain. My Chichewa is not very good, so I'm not going to even attempt to to tell you what these other roles are. And then if I go now to, if I carry on round the dial, I'm going to just show you the environments. So you saw before when I did the demo earlier, you saw that pre-op environment from a hospital in the United States. Again, whenever we go live with World Child Cancer in any of the hospitals, we create custom environments for those hospitals. I'm going to show you this environment, which I believe I did. This is Malawi, isn't it? Yes.
Yes,
Yeah.
it is.
Yeah. Great. Great. So what I'm going to do is I'm going to show you this in augmented reality. So I'm going to tap the red balloon. I'm just going to pick up my iPad. And we'll just wait for the balloon to appear and turn green. And just as you saw before, the environment now appears on my desk. And this is an accurate model, obviously in the Xploro style, of the hospital environment in Malawi. We can go around, we can see some patients in the beds. There's some mosquito nets there hanging above the beds. If I come around here, there's someone working at the desk there. I'll come over here. And you can see some avatars walking around. Now, again, as before, if I've customized any of those avatars in the staff section, they would be the avatars that are walking around this environment. So, so I think that's pretty much it that I wanted to show you in terms of localization. I just wanted to show you how we're making sure that when we do localize in any other country, and we've done this for Indonesia, we've done it for Nepal, we've done it for Cameroon, we ensure that the avatars are representational of local cultures and customs. We're actually doing an Arabic version at the moment where we're having to swap the whole user interface from left to right to left, and that's creating some interesting customizations as well in terms of clothing styles. But hopefully you can see there how we localize for different countries and different cultures. Okay, great. I'm going to stop sharing my screen now.
Thanks very much, Tom. I must say that this has been a great learning for myself too. And while I'm opening the next session to questions and answers, I may also have questions myself. Okay, so we've got one question here so far. Is the use of apps available to countries not supported by WCC?
So, I mean, Xploro is available to any healthcare system that wants to deploy it. I presume that this question means, is the use of the app available on the same terms that we work with WCC? So what I would say is the support we give to WCC is quite extensive, and we're not in a position where we can do that for every low and middle income country. However, if you would like a conversation with me, then please do contact me outside of this call, and we'll do whatever we can to support you wherever you are. I can be contacted. Maybe I can put my email address in the chat, which I'll do now.
Thank you, Tom. We have another question from Adikemi. Apologies if I'm mispronouncing your name. I'm just going to open your mic, so please feel free to share your question.
Hello.
Hi.
Good day, everyone. Adikemi. I'm from Nigeria, and I'm a childhood cancer survivor as well. It's great to hear a lot about Xploro, and I think for me, this is one of the challenges that I encountered as a child, not having access to information and understanding what treatment I was actually exposed to, and possibly what are the late effects I may encounter. So my question would center around, I think, one of it was what the other person asked around having it accessible to other countries in the low and medium income country. My second question would be, I love the approach on, localizing it so that it's very relatable to the environment, but how sustainable is that? I assume that Xploro would want to, be available in the nearest future to every environment and just accessible to everyone. And so how sustainable is that approach? And on a third note, I looking at it because I had to even download it. I saw it on App Store and looking at it, I don't know, even though I don't have access to it, but looking at the demo you gave us, it didn't seem like it gave a little introduction about what disease, what type of cancer the child is being treated for. So is there something like when you log on to it, you're customizing it based on yourself? Does it give a little background about the type of cancer the child is being diagnosed of? And also something that I lacked as a person at the time, which I would love to see if Xploro would be looking into in the nearest future, is having something to do outside of just the medical part of it. Say something to relax the mind of the child. Either, you know that most children may miss out on school. Is there a way to incorporate some studies into it? I just want to understand so that there's a blend of the educational part and the care part that the Xploro is looking into. So it would be nice to hear what the plan is for Xploro as a hub, especially just reaching out and the gap basically that we have when it comes to children with cancer. Thank you.
Thank you. Thanks for all those questions. I'll try and remember all of the questions you asked, but if I forget to answer any of them, do remind me. So I'm going to start. I think the first thing you said was, following up on that first question about the availability of Xploro in countries not supported by WCC. So as before, my email address is in the chat, so feel free to email me and we can start a discussion about that. You asked about the how sustainable it is to have a model that is based on localizing for every country. So we're doing it one country at a time. Our long-term and very lofty ambition is to be a health education platform for any patient of any age with any condition anywhere in the world. That is an enormous challenge that we will never fully meet, but that's what we're aiming for. So one country at a time. So whilst we might not be able to support every country straight away, we are getting there slowly. You asked as well, I think, about personalization in terms of diseases. So is there any information that tells a child about their own diagnosis? So I think the answer to that is yes and no. The no part is that we don't know anything about the child's diagnosis. And so the information that we provide is generalized. However, there is a way in which you can create a very personalized journey. And I won't go into the technicalities of that now, but I'll just give an overview. In our management system, which I haven't shown at all today, you can create customized content areas for individual patients. So let's say we had some information that was specifically about ALL, for example. You can create a content bucket, if you like, or a content folder that has all of that information about ALL, and you can direct your ALL patients to that content folder. In fact, that's the only content they'll see. And you can do that with any kind of subsection of content. So in that way, you can decide what pieces of content your individual patients see, and you can tailor that content in that way. But we, as a company, don't have any knowledge of diagnosis, and one of the reasons for that is information security. It becomes a much more difficult challenge for us if we know that information. And I think your final question, you may have asked more. I think your final question was about content outside of direct medical content. wellness content, distraction content, that sort of thing. And that's very much on our roadmap. In the United States, we're working with a health insurer where we are beginning to create a lot of content around wellness. So in the future, we will have that wellness content as well. So apologies if I missed any of your questions there, but I think I probably covered it all.
Yes, I think you covered everything. Thank you very much.
Great, thanks.
Thank you. Tom, by the way, you shared your email address in the chat, but would you please make it available to everyone, because it is currently available to hosts and panelists.
Right, I beg your pardon.
Thank you so much. We've got 2 more questions. For a child who cannot read, can they still use Xploro?
Absolutely. I turned off the read aloud functionality, but all of that content is read aloud in a child's voice. That child voice is also localized. So when it was on briefly at the top of the demonstration, it was an English voice. We also have a US voice. We don't yet have a Ghanaian or a Malawian voice, but that's something we'd definitely like to look into. So absolutely, a child who can't read can use Xploro.
Thank you.
Ghazale, just so you know, there are some questions in the chat as well as the questions in the Q&A.
And the next one in Q&A section is from Georgia. Such an incredible app. Can you tell us more about the expert advisory board that are involved in the development of Xploro? Good question.
Yeah. I'd love to tell you more about the expert advisory board. They are fantastic. I mean, they basically decide what makes the cut for Xploro. They tell us when we're getting things right, when we're getting things wrong. They're very honest, unlike grown-ups. Lucy, I'm sure you won't mind me saying that Evan, your son, was one of our founder members of the expert advisory board. I think he joined when he was, 10? And he's now 16. So yeah, so we've got amazing group of children, very diverse group in terms of experience. So some of them have, in some cases, been through intensive hospital care throughout their lives, and in other cases, some of them have never been into hospital at all. We've got neurodiversity as well represented, and some of the input we get from some of the children really helps us think about how we describe the sounds, smells, and colours in an experience. We've also just formed our first. So at the moment, our expert advisory board is UK-based children, or it has been up until recently. We've just formed our US, or actually I should say North American, because some of the members are Canadian as well, our North American expert advisory board, which is, they had their first meeting yesterday, in fact. So it's following the same model as the UK board. Again, similar diversity amongst the group. In fact, if anyone goes to our website, there's a video under a section called Xploro Tour, which was made by one of our North American expert advisors. She's 13 years old, and she took it upon herself to create a video showing everyone around Xploro, which is a really lovely video.
Amazing. Thanks, Tom. And another question in the webinar chat. Is the app available for palliative care for non-curable cancers, like an adaptation of some sort?
Interesting. So we've had some conversations with palliative care units about creating content, not just around palliative care, but also outside of the cancer domain. We've had some conversations with an organisation about using Xploro to help children understand when their parents and caregivers are dying. So It's something we don't yet have any content around palliative care, but it's something that if we can find the right way of talking about it, then we'd be very interested in developing.
Thank you. Any more questions? Anyone? Oh, there is one more in the webinar chat. Can I use Xploro with a parent or caregiver? I guess we
Yes.
covered, but yeah.
Yes, absolutely. And we've had a lot of cases where that's been very successful. I think Lucy mentioned in some of the research that she did. I think, Lucy, you found that the effect on parents and caregivers was similar to the effect on children.
Yeah, 100%. So as a parent, we know children have better experiences if parents know what's going to happen, if they're equipped with knowledge themselves, if they're able to act in a coaching role to their child. And the only way that parents can do that is if they know what's going to happen also. And so, yeah, we found that it worked really, really well to equip parents with the skills before they can then support their child.
Just to add on, yeah, it's good for the parents to be engaged in using Xploro. So what we observe is the parents tend to understand more about the procedure that the child is going to have, and that also like helps the parents to better support the child. Yeah.
Amazing. And if it's okay, I just ask one question from my in relation to the app. To what extent have you observed exchange of learnings between users? Like a child who would be running to another child in the ward who would be sharing, what he or she has learned from the app. Peer-to-peer support, which has been encouraged by the knowledge empowerment feature of the app.
That's a really interesting question. I have to say, from my point of view, it's not something we're privy to in terms of seeing that engagement on the ground. But maybe Augusta or Aida, maybe you've seen examples of that.
Yeah, so I can say that with that games section, the children like to play together because sometimes it looks challenging. So maybe one knows how to play it and the other one learns from it. And I've had children learn about the scans together. So yes. Thank you.
Yes, there's that peer support, and sometimes it happens. Maybe a child who had a procedure that is similar to a procedure that another child is going to have. So you find that one also supporting her friends or his friends that when you're going to this section, this is what happens. This is what you're going to meet exactly, and he also explains more. Yeah.
That's fascinating, really. When I think about it, what happens in the context when the app is used. Thanks very much. We have a few more minutes if there is any further questions from anyone. I was in a workshop a few days ago, Dom, and chatting with WHO with a consultant from WHO office in London. I was just telling him about this upcoming workshop session on Global Cancer Week, and briefed him on Xploro and on the app, and how I have also observed the use of this app in Queen Elizabeth Central Hospital, sitting next to Ida and just watching how she engages with children. And there was a question which also engaged my mind, and that was like, to what extent we have observed informed decisions, health decisions made by children or their parents after after the information which has been given to them by this app. For example, have they reached the point that they make an informed decision of not accepting one particular treatment, which is still like precious in the sense that it obviously shows their engagement, their empowerment, the ability to make an informed decision. And then at that point, to what extent the healthcare professionals engage with, to further make them aware about the treatment.
So again, I'll hand over in a second to Augusta and Aida and see if they've got any examples of that. But I have one anecdotal example in a sedation unit in the USA, where we've developed a lot of content around end-to-end sedation encounters, and we've seen an example where sometimes the children are educating the patients, so they've learned something in Xploro. Sorry, the children are educating the parents or caregivers, so they've learned something in Xploro. For example, the need not to eat before having a sedative, and then communicated that to their parents and reinforced that with their parents, which has been really interesting to see.
Okay, so I would like to also say that some parents do not know some of the things that is involved in the procedures. So when it comes to explaining with a scan and some of the things that they have to do, some parents do not know actually the things that they are to expect, because sometimes they might not have done that before. It's their first time, their child is ill, they have to come to the hospital. And so it gives them a first-hand information, and then they get to understand. And some actually say, okay, I think I need this app on my phone, and then you have to download it to them. Download it and then give them the code. So it's very helpful when it comes to giving information to the parents, because yes, it helps them to understand some of the things that goes on in the hospital. Yeah, I think, I don't know that there's another question.
Yes, it does. It does. Thank you very much. It's been a great session, very insightful. Yes, thank you, Dom, Lucy, for your time, for joining the session and sharing your presentations. It's a game changer, really, use of this app in relation, to the extent that we are working in low and middle income countries, really, in relation to what we do, the projects we deliver, and the experience that we change for children when going through treatment. Thanks very much. I wish you all a nice rest of the day.
Thank you.
Thanks.
Thank you.
Bye.
Thank you.
Thank
Bye.
you.
Bye. Bye.
Bye.